Welcome to the Dusty Muffins, where menopause meets sisterhood and strength. We're three menopause specialists coming together to laugh, share, and empower you through the wild ride of menopause and perimenopause. Whether you're curious, confused, or just looking for real talk, you're in the right place. We're here to answer your burning questions, educate, and advocate, all with a dash of humor and a lot of heart. So pull up a chair and join the conversation. Before we dive in, please remember, while we're doctors, we're not your doctors. This podcast is for educational purposes only and is not a substitute for medical advice. We encourage you to partner with your own medical clinician to address your unique health needs. This is the Dusty Muffins.
Welcome to the Dusty Muffins, where today we're going to delve into the art of mindful living. And today we're joined by Dr. Amanda Skowron Romano, a clinical psychologist and founder of Peace of Mindfulness, LLC, right here with me in Northern Virginia. She has over 12 years of experience, and Dr. Skowron Romano specializes in integrating mindfulness into therapy, helping individuals navigate life's challenges with clarity and compassion. Let's explore the transformative power of mindfulness together.
I am Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician and a Menopause Society certified practitioner. I have a private telemedicine practice, and I see patients in several different states.
I am Dr. Aoife O'Sullivan, a board-certified family physician and Menopause Society certified practitioner, and I see patients through my telemedicine practice here in Oregon and Washington.
I'm Dr. Christine Hart Kress, a board-certified women's health nurse practitioner and menopause certified practitioner, and I see patients via telemedicine in several states as well. Well, welcome, my friend.
Hello. Thanks for dealing with some of our technical stuff that sometimes just happens.
Part of
life. We just keep going on.
In mindfulness, right?
Yeah,
that's why we all need therapy.
Sure. At the very least, for that, right? To keep us from losing our minds, as we can feel it start to boil up. The anxiety, the
We got this.
But that's
together.
That's kind of like real life, though, right? Nothing. I mean, this is real life. This is what happens. This is what our followers go through. We go through. So it's all right.
Right. It's a perfect segue into mindfulness.
Yes.
Yeah. So tell us, have you always been interested in mindfulness? Why don't you tell us what the background is about the name of your practice?
Oh, I love that. Yeah. So, clinical psychologist who did therapy, interestingly, had never meditated in my life, anything before grad school. So I had done my whole undergrad, did some research in undergrad about postpartum depression. And when you go to grad school, you usually pick your mentor. I picked my mentor, was heading in that direction. My dissertation was on postpartum depression. But while I was there, started to learn more and more about anxiety and stress management, and just happened to find this. Ended up having the amazing opportunity to have two mentors. And my other mentor was, she did all mindfulness. And we had this moment where she's like, it seems like this is of interest to you, and you really can't teach this unless you practice. And so she encouraged me to attend an 8-week mindfulness-based stress reduction course, which is kind of in the medical world. They use it a lot with chronic illness. And that's where it all began. So when I sit across from somebody and they say, it's really hard to just sit there by yourself. Yes, it is. No one's it's a skill. It takes a lot of practice. And so I started there. And when you start to go through that training, then they kind of encourage you to have that daily practice. And then got to my postdoc, and my supervisor there was like, "You've never done a silent meditation retreat?" And I was like, "No, what's that about?" And
did you do it?
Yeah, I did. So 9 days. I went 9 days. You don't speak for 9 days. You actually wake up in the
Christine, you could not be able to do it. She'd not be able to do it.
I mean, I'm a pretty
She'd be like, take me home.
That would be torture.
Yeah, so you don't
I would be like, yes.
Nothing.
I don't think it would be.
Great. I don't mind not talking. Seriously, all morning long, I'll go all morning getting ready. And my husband's dying because he and Christine are very much alike. He's just like, blah, 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 blah. And I'm like, give me some moments of silence.
Yes.
You went 9 days without speaking.
9 days. So you wake up and
Wow.
you do mindful eating, and then you do this like 45 minutes of walking meditation and 45 minutes of sitting and walking, sitting, have lunch. And in the evenings, you would have a talk, but it would be the teacher talking to you. And if you had a question, you could, but most of us know went the entire time without speaking. So so I'm a pretty talkative person, and it was even to speak then once I got picked up, it was strange. Like, first of all, I'm a pretty fast talker. I was talking so slowly. My voice actually sounded a little bit different because I talk back-to-back clients. Like, our voices get strained, right? So to go that long without, like, it was interesting. My voice had a hard time there going back to my work and being able to talk that many days. So I promise all of my clients, you can go the whole time and never do a 9-day silent meditation retreat. Like, that is not
Wow.
It's
Can you, for our listeners and maybe for people that don't understand what mindfulness is, and can you go through that, like, for us, kind of just like those definitions of, what is that, and then we can kind of go in, how is it used, and just some of these terms that are becoming more conventional, but for a lot that don't understand.
Oh, that's such a great question, because whenever you say mindfulness, everybody could be meaning something different. So as I mentioned to you, I had gone to an mindfulness-based stress reduction, or MBSR course, is by John Kabat-Zinn. So I often use his definition of mindfulness. And so it's the non-judgmental awareness in the present moment. So we're doing two things there. We're allowing ourselves to, our minds, if you just let them go wherever they want, they either tend to want to speed ahead or focus on things that have already happened. And if I could, this is a really quick summary, but when we're always focusing on future things, we tend to get a lot of stress and anxiety. When we keep revisiting past events, we get a little bit more of that sadness and depression. And so this idea of being in the moment, I'll explain it for someone who's like, have you ever gone on a run, or you're a painter, or you're cooking, when you're just like literally just in it, right? Like, that's that present moment awareness. Now, the non-judgmental stance, it takes a little bit more work to help someone understand what that means. But many times when you're in the moment, we want it to be different than what it is. So you'll be even chatting with a lovely group of people, and you might think, it'd be better if I had coffee, or if it'd be better if my camera was working, or like, our minds love to play this game of like, but it could be better, and like really just wanting things to be different than what they are. So it's not only helping someone to be in the moment, but to be accepting of whatever's there. Because when you meditate, you're going to meditate. If you meditate consistently, you're going to feel anxious at times, and you're going to feel sad at times. And so people have this misunderstanding that you sit and you're calm 100% of the time. And so when I say to them, that's actually not the experience that we have. And one of the main things we get from therapy and mindfulness is distress tolerance, is to know that there's a lot of things in life that are uncomfortable, and how do we actually breathe and sit through that? I got to hit you guys with one more fact that I just love. It's really interesting. So every emotion we have has a physical aspect. If we can sit with an emotion, it will come, peak, and fall within about 90 seconds. So why can we go the whole day feeling
I don't know. Not my emotions.
Our thoughts, like, we feel that moment of like worry or anxiety, and we want it to go away, right? So like, just stop thinking about that. Stop.
Yeah.
And the more that you tell yourself not to have an emotion or experience, the more you get of it. So there's a lot of value.
So it's kind of like when you're sitting with all of us, or if we're in a conversation, really trying to keep your head in the moment of those conversations with, your friends or your patients, instead of letting your brain go, boy, I have to go get this done today. I can't forget to do this, and can't forget to do this, or type of thing. Like, really experience the actual experience. Yeah,
yes. Whenever I would
it's hard sometimes.
I would do a lot of mindfulness groups. And so one of the exercises we would do is we would have you partner up with somebody, and for 2 minutes straight, you had to sit there and listen to a person without interjecting. And you just had to one person was the listener and one person was the speaker, and then you would switch. And it's an interesting experience because you realize you just want to connect with the person. So what happens is they start to tell you about their job, and then you have this natural inclination to want to jump in, and then you start talking about your job, and then all of a sudden the conversation will take this left turn. So it's this really cool experience of like, what does it feel like to want to jump in and you just don't, and you let them talk longer, and you learn so much more about a person when you give them that space. So that's mindfulness. It really can help us understand ourselves and others a lot better.
And I think that, like, when you explain it as a clinician, like, I totally get it, because that's one of the things I really have tried to do as I've become more seasoned is to listen more with my patients and talk less. But at 2:00 in the morning when I have heart palpitations and I'm awake, I don't really like sitting in that.
Yeah.
So you're telling me that I just need to sit in it and like what?
Wait 90 seconds.
Yeah.
Well, 2 hours later, I've gone beyond the 90 seconds. So how do I get myself to go back to sleep? I hate that.
Mm-hmm.
Oh, that's such a great question, because sleep is such a big thing, right? Like, especially for women, so that's why I like learning certain techniques, breathing, different practices. So I will sometimes give people a recorded guided meditation. I will teach them different diaphragmatic breathing, something they can do in those moments. So we don't just say good luck and try to sit through it, right? We give you some tools to know how to ride that wave, how to ride that 90-second wave, right? So think of a surfer, right? And think of it as being, and most people that are surfing, they have a skill set to get them through that wave. So that's one of the benefits of working with someone trained in these techniques. We're going to give you a skill set to get through those moments, so that it is more of a couple minutes at most, definitely not hours.
That's really awesome. So I have one question that I thought was kind of interesting. We think about therapy when, we're actively going through something, we're in a crisis, but, it's not always just about healing some type of pain, right? What about just some like non-crisis reasons that women may come to therapy, either preventatively or just as part of their maybe mindfulness, or part of, being kind of a whole person?
Yeah, this is my favorite thing to talk about, is helping to kind of have a different understanding of therapy. And I was sharing that I like to listen to some podcast episodes before I join a podcast. And one of the things where I think you guys could really understand this is, you guys were talking a lot about this. You were saying that a lot of women will come to you and are like, well, I wasn't having hot flashes, so that's why I didn't think to kind of seek out and do some of these treatments. Or these are better, but I still, I'm having this, and this. And, like the hot flashes are better, but I'm not sleeping. I have brain fog. I'm having joint pain. And you guys are all like, we can do things for those as well. And I think that's kind of where therapy has been, is that a lot of people think of, if I had a childhood trauma, if I had these significant life events. And one of my favorite parts I was at an integrative center. So I was in a primary care office. And so I got to see a lot of people who had never even considered therapy. So how did they end up in my office is that I was down the hall. So their primary care would be like, you are having sleep issues. Have you ever talked to someone about that? You are having IBS, right? Like you're having a lot of stomach issues, digestive concerns. So whenever I talk to someone about the nervous system, if we think about, fight, flight, freeze. Everybody knows that part of the nervous system, but no one knows rest, digest, restore. It's called rest and digest. If I can literally help you with those techniques that Christine was kind of talking about, that we could use at 2 a.m. in the morning, right? Those techniques, if you use those consistently throughout the day, you're in your parasympathetic nervous system more. If I can help you to be in that space much more than your fight or flight, you digest your food better, you sleep better, your stress levels are lower, which means your cortisol levels. Like it's a whole, when I talk about mind body, like that mind body connection, I genuinely mean it, because I just cannot separate it. Like that idea of how our thoughts physically impact us and how our physical health impacts our thoughts, and just helping to understand that. So I always say that if you are a human being walking this earth, there is something I can probably teach you to help you to walk it a little bit smoother, right? And it breaks my heart sometimes, because I work with a lot of new moms, and they'll say these things to me like, I have an easy baby. I feel so guilty for talking to you, right? Like this should be the happiest time of my life. I have an easy baby. What? And I'm like, you're raising another human being, right? Or even how much you guys more than anybody know this. Career changes, relationship concerns, right? When we get to that perimenopause, menopause, there's a lot that we can do. So I like to engage in something called acceptance and commitment therapy. And it's a lot about like, what do you actually want your life to look like, which we refer to as values? What is actually happening? And what is that discrepancy? And so this really intentional, like, what are our days looking like? Most of us get up, we go to work, we do, and it's really bringing a lot of intention to how we spend our day and the things we choose to do throughout the day. So.
Amanda, when you talk about the rest and digest, do you use any of those vagus nerve activation techniques or wearables or anything like that?
Yes. So I just love everything about the vagus nerve, calming the body down. And so it's really cool. Like even in terms of, when we were at the center, and I'll still encourage, I have no affiliation with HeartMath. I have nothing, or Muse, but there's some really helpful things out there. Same reason many of us wear Apple Watches, right? Sometimes it's nice to get some data about what's going on. So for example, if anyone's not familiar, there's something called HeartMath, a little sensor, you put it on your ear, and in real time, I'd have someone say, talk to me about a worry that you have. And you get to see in real time what that does to our heart rate, to our respiration. And then I'd say to them, you know, that 4-7-8 breathing we just did, let's do it together, right? And in real time, you see it instantly, how it impacts your body. And I'll say, could you imagine if you lived in this 24/7?
Mm-hmm.
And then you're like, why is my stomach always upset? I think we know, right? So it's really cool. There's a whole bunch of different, the Muse does more of like looking at brain waves, but there's a lot of cool things out there to help you to understand how to activate the vagus nerve, how to calm our nervous system.
I have a thing called the Apollo Neuro, which I saw on a Facebook group years ago. I was learning about Dr. Stephen Porges. He had come up with this music to activate the vagus nerve for kids who had autism and who had kind of disconnected socially. And he removed some of the frequencies from the music, and the kids would listen to the music and come back online. And someone had developed this wearable, and this is not a sponsored post, but I thought, you know what, I'm going to give it a go just to see what it feels like, and then I can tell my patients about it. Well, I haven't taken it off, and that was probably 5 years ago. It comes on and it vibrates, and it's supposed to activate your vagus nerve by doing that. And I know there's a few different wearables like that, which are so helpful for people too. I feel like it brings you back into the moment. You feel that little vibration on your wrist, or you can wear it on your chest or ankle, anywhere really. And it's lovely. It's like a little hit of dopamine or something every time it comes on.
What I love what you said about there too is that you tried it yourself. I'm a really big advocate of that as well. Mm-hmm. And one of the reasons I was really drawn to mindfulness is this idea of like, we're all human beings. I'm not going to sit across from you and act like I don't get stressed out, that I don't think it's hard to meditate at times. And so to have these mentors in my life that were like, just that honest of like, life is hard. Can we life better together? Right? Like, mm-hmm. And so even being at the Integrative Center was awesome because I got a chance to try acupuncture, Reiki, working with the naturopathic, like just all of these different things. And it was a really cool, so I can say, because sometimes there's recommendations given out, right? Like something, it sounds simple, like don't eat gluten. Have you ever really tried to cut gluten out of your diet? Like it impacts your social aspect, what you have to look at, like this really awesome experience of like, I had to do it for 2 weeks and I was like, this is hard. Like, so just to have these different experiences. And like I said, even when someone says to me, like, what is your actual experience of meditating? I'm so honest with my clients. Like, this is what I struggle with. This is how I've worked through it. This is what could be helpful. And again, that's what I loved about listening to some of the episodes, you guys honestly talking about this journey for yourselves. Right. And I think there's a huge, just like connection point there of saying like, I always say to my clients, like, I am the expert in some techniques, but you genuinely are the expert of your life. So if I tell you to do something and you come back and you're like, that was awful, I believe you. And I'll say, let's try something else for that system, or let's talk through this in a different way then.
And a lot of what we do in our practice is starting women who are going through the menopause transition on hormones. Have you seen patients where you're working with them, and then they go off and they start on hormones and you see changes in them then?
100%. So that's what, like, I love the collaboration with different, and I know we're just starting to get to know each other by Christine and Rebbecca. You guys, I'm always hounding them. Like, someone's coming your way. Like, because
we thank you. Yeah.
Yes, because I have stress and anxiety management. So someone will come to my office and they'll say, like, I'm having heart palpitations. They think I'm having panic attacks, and we've done a heart workup, or we're doing these different things, and I just don't feel like myself, and like I'm just forgetting a lot. And randomly I had cold shoulder, and I'm like, time out. So you're telling me you have cold shoulder, brain fog, not sleeping well, your heart's going, you should really chat with my friends, because then I'll say to them, I know enough when it needs to be assessed. That's not my area. So that's why I love knowing you lovely ladies, because I'll say, like, they'll answer, and then I will you guys will sign a release and I will be able to talk directly with them and I can fill them in on where you're at with your anxiety and some things I'm noticing. And it's such a cool experience to actually see them say, you know what, I am worth this. And I am going to collaborate with one of your colleagues, and they come back and like, I feel like myself again. And so as much as I know how helpful it is to talk, I do believe that there is that physical mind-body connection, right? So I'll say to them, like, let's not swim upstream. We can talk to her blue in the face, but like, I can do so much for like your cortisol levels and your hormones, but like sometimes we need hormones, right? Like you need to introduce into your body to actually get it regulated.
Yeah.
And if we can get you so far with my work, so far with my colleagues' work, can you imagine what we could do with all of this together? It's a really cool experience.
I know, but it's getting women to realize, I think, a little bit, that they are worth that investment. And then when they even get in with us, it's like menopausal hormone therapy isn't going to do everything for you without the things that you're talking about, mindfulness or exercise, nutrition. I mean, and then, getting women to just to stop and prioritize themselves in this period of time, I find is just really, really challenging. And the amount of things that they just tolerate instead of trying to address. I mean, are you seeing that, or what do you tell women about prioritizing themselves and not tolerating being gaslit or feeling like garbage?
Yes, absolutely. I see that so much. So every time I see like a commercial about like self-care and it's like a bubble bath or that occasional massage, like that is not self-care. That is not. Self-care is actually meaning like we're taking care of ourselves. And that's why why is there so much talk about strength training, right? Is because for someone that it's so empowering, right? I love the idea of just empowering people that I work with. And it is empowering to try something you haven't done before. And a lot of people are just intimidated by strength training, right? A lot of people are intimidated by mindfulness techniques or talking with a therapist. It's just something they haven't done before. And so it's that idea of like, am I going to make time for this or not? And so I will say to someone like, even just give us a shot, right? So like, that's why I try to do a lot of talks like this, just to even give someone a taste of like what it might be like to talk with someone. And then many times when I meet with someone, I'll say, listen, there's some people I meet for a handful of sessions and there's some people I meet for years, right? Like it all just depends on what you're looking for. And so I think it's really, you guys probably have to experience this as well. So we live in this world of the medical care being a sick model, right? So even when I was at the primary care office, our sick visits were always full. And then we would do wellness workshops and it would be like crickets. And we're like, well, this is so wrong, right? Like we need to help them to understand. And so I'll share with someone, one of my favorite meditations is it's this like metaphor of using a tree. And it will talk about like when someone comes to me and they're really anxious or stressed out, or it's kind of like if you were to see a tree during a storm and the branches and the leaves are everywhere and you think that tree is going to break. There's no way that tree is going to make it. And in this meditation, it helps you to realize you have the trunk and you have the roots. And that's what helps you to get through those storms. That's how I think about what we're doing when I talk about lifestyle change. So when someone is talking with someone, meditating consistently, working out, getting sleep, you're getting those roots nice and strong, right? So if we have that tree and we're taking care of it, then when that storm comes through, you're still going to move, like talking to me is not going to prevent menopause. I'm not that good, right?
Really? Come on now.
I can get your roots
Can't you
strong.
will it? Isn't that what cognitive behavioral therapy is? You just will it away.
It's magical, right? But I can help you to have those stronger roots through lifestyle changes, that storm, you don't feel like the twig in the storm. You feel like you can weather it a bit more. And I think helping someone to understand that, like, why would you ever wait till you're sick, right? That's where like we try to encourage people to do those at least once a year wellness preventative visits. And I love the world that we live in, that could be for psychology as well. So when someone says, that's awful that you've seen a psychologist forever, you must be so sick, or I adore my clients, all extremely high functioning. And I like to think they are high functioning because they have worked with me throughout all of this time. Sometimes I see them once a month. then life happens and I'll see them once a week, and then I won't see them for 6 months, and then I won't, they just know I'm there, right? And they know enough. I always tell them, please come to me when there's smoke. Don't wait for the huge fire. We will put out the fire if you come to me with that. But the smoke is so much easier. So like, just remember me, you know? So I would say that it's something, I see a lot of fires at first. And then when someone starts to work with me, I've noticed so many of my clients are getting so good at identifying when it's smoke and coming in more of that preventative fashion.
Yeah, never would have thought about that until you said it. So thank you.
I had a patient a few years ago, a man, and I could tell from everything, he just had so many anger issues. And he was a really nice guy, but he just would flip the lid, you know, really quickly and just didn't know how to deal with it at all. And I brought up very gingerly the topic of seeing a therapist. And he was absolutely horrified. He said, I'm not a rapist or something. And I was like, wait a second, what? You think those are the people who see therapists? I'm like, rapists do not see therapists,
No.
trust me.
That's the problem.
I wish.
So we had a whole conversation about who has therapy. And I said to him, I think every human should have therapy. Even for 6 months or a year. I said, you learn an awful lot about yourself. You learn coping skills and techniques. And he left and he was not very happy with me. And I didn't see him for about 9 months. And he came back and we just had a regular visit. I think it was like maybe blood pressure or something like that. And at the end, he said, I took your advice. And it had actually been so long since I'd seen him, I didn't know what he was talking about. And I said, what do you mean? He said, I went and found a therapist and I feel great. I've been working on myself and I want to thank you for suggesting it. I was just blown away.
Wow.
Yeah, I mean, I really do feel like every human should have therapy.
It's so important. I'll tell you.
Yeah.
I did that quick when my ex-husband and our 3 older children, when we had decided that, you know, we were going to co-parent, and we took the kids to therapy first. So everything was great. We co-parented wonderfully, but we were just like, we need to make sure that everything is good. And if they have something they need to talk about, that we can't. So yeah, we didn't wait until there was any, you know, trauma or outwardly anyway that we could see. And it was and I remember my kids now, they're all adults now, just, you know, that thinking. And I think that we just really transitioned that so great. And even my current husband now, we did therapy on how to blend our family together. And so, you know, it's just been.
Just head things off at the pass, you know? Yeah.
Right, because when you have that established relationship already with somebody and then something happens, like it's hard enough to be going through that, let alone finding a therapist at that time. Like that's even a lot to take on, you know? So 2 thoughts I had, I just want to rewind so I don't forget to share. I think that's one of the things I loved about being in the primary care office, because they would pull me into it. Like they would literally call my office and I would walk in and I would just, first of all, I'm not a terribly scary person. So I think that kind of took off the edge to start with. And then I would kind of like talk them through like even just a breathing or what I would do if they came to see me, and kind of gave them a bit of a treatment plan and was like, you know, we would start with your sleep. Like if you do have something, like we don't have to start at the scariest moments in life. We can start like, I work in a lot of different areas, you know? So, so that was really cool just to kind of help someone to understand right from the beginning, like while they were in office, like to chat with them to see how the benefits of therapy. But then yes, to your amazing point of just that connection is so important. So I offer a free 15-minute phone consultation with anyone who's considering to be my client, because a lot of people don't know we're trained differently. So I'm a psychologist that is trained in stress and anxiety management and mindfulness and integrative health. And so I talk a ton about, it always makes me laugh when someone's like, this is too much information. I was like, no, like what's happening in your stomach is actually helping me to know what's happening with your anxiety that's happening. And I would go to all of these meetings. I've worked with medical physicians forever. Like those symptoms allow me to know when I need to get them back to you guys. Right. So, but not everyone's trained that way. Or I do a lot of work in sexual health. So if you come to see me, I am going to ask you about those areas. Everyone just assumes that, you know, a lot of times, so I do couples therapy, and I had a couple that was like, we were concerned about our sex life. We went to the couples therapist, but they never asked us and we were too embarrassed and ashamed to bring it up. So they left couples therapy and never talked about their sex life. So it's just like this interesting moment where you would assume that everyone assesses all of these different areas, and they don't. So when someone calls me for that 15-minute consultation, they'll give me a snapshot of what their main concerns are. I'll give them a snapshot of, I'm trained in these empirically based. I can give you a whole bunch of different like homework and coping strategies, but I also I like the processing. So we are going to process and talk about, so I like this combination. Not everybody's like that. Some people will say, I only got worksheets from someone, or I just talked the entire time. And so each of us work very differently. So I like to be very honest when someone calls and I'm like, this is my approach. And I'll say to them, I'm not going anywhere. Talk to a couple other psychologists. Make sure it feels like a good fit. Like, you're going to be telling us personal details. You want to have that relationship, and because when someone says therapy didn't work, my instant thought is usually they just didn't find the right fit is probably the bigger issue.
That's what I see too when patients, and sometimes now they're finally getting, I don't want to call it brave, but maybe just aware enough that they just didn't click with him, just with anyone. Not everybody clicks. Yeah. And so and I would assume that especially in therapy, but I really would extend it to all medicine. If you're not clicking with your clinician, you're just not going to feel good and it's not going to be satisfying. And it is, we talk about this all the time. It's really, medicine's become this team approach. Like, we cannot do it all. It really is, you have a team that supports you,
I mean, are you all telemedicine? Is that how you do all your care?
Yeah. So before the pandemic, I always was half-time telehealth already because I saw so many new moms and people with medical conditions. So as Christine said, we're in Northern Virginia. So in DC, you're not getting anywhere in less than 45 minutes. Yeah. So people are like, I'm driving 45 minutes for a 45-minute session. So I had a lot of people already on the telehealth mode before the pandemic, right? And then after the pandemic, so the nice thing too is what was happening was I was licensed in Maryland, Virginia, and Pennsylvania. Again, we're in the DC metro area. So if somebody would move 5 miles, sorry, I've seen you for 3 years, but now I can't see you because you're in DC. So they were realizing with the mental health shortage. And so for psychologists, we can become part of something called PsyPact, which means that I can now see people in 42 states, including the DC area. So it's really awesome because there's a lot of people who are interested in my specific training of this mind-body medicine and understanding menopause and hormones and women's health. And now they have access to providers like us,
and there's not many. And so that's really what's cool. Important too, right? We really, it's so awesome because I think that we don't have enough clinicians, so it's just been so great that the telehealth helps provide that too. And for patients who just don't want to leave, right? They feel comfortable at home telling you these things. So important.
I love that, right? Yeah, just that own kind of some of that own comfort. Oh, absolutely.
Do you ever get any pushback though? I mean, I get every now and then I get some pushback with patients of, I don't feel like I'm going to have that genuine connection if we're not in the same room together. So, I get every now and then I see that. And then, I mean, do you think that being, over the Zoom that, your essence of mindfulness and connection, like, how do you make sure that that's not lost in this virtual realm?
Yes. Yeah, I definitely get that too. And I'll respect that. So when someone says, let's try it out, you're always welcome to say it's not the best fit, right? And have I had that experience where someone's like, I think I'm going to try someone in person, or absolutely. But I think that for me, at least when it comes to mindfulness, it's just the level of attention that I try to listen and give to someone and be very just there and to provide that space. And I could be wrong, but I think if you ask the majority of my clients, they're like, you're Amanda, whether you're in Zoom or in person. Yeah. So, just that, I give a very heartfelt approach, and you can feel that. I like to think most people say we get your personality through. So again, so if somebody really wants in person, I respect it 100%. But a lot of people will say, I still feel like I gain a lot of benefit and just that convenience, because if they go on vacation, right? Like I said, I can see in 42 states. Mm-hmm. Technically, if someone went on vacation, I wasn't able to see them before, right? But now some of the times the most stressful things are during the holidays. Yeah. or when you are on vacation with your family. And could you imagine how many people, they love it. They get to step out and they get to do telehealth with me. And they're like, my holidays are better. My vacations are better. Like, you know what I mean? Because they're just like, I actually get to enjoy these people around me versus just feeling stressed out. So I like to think too, it's just been really cool to actually gives my clients so much more access to me than they had before, in all honesty. So
I wish
I think the pros outweigh the cons.
I wish we could get to that place in medicine as well, especially with the DEA. You know, the DEA is a federal number, and yet you have to have one for each
Makes
state.
no sense.
I mean, and you can't get one for each state unless you have an address in that state.
That's right.
And who
And
has addresses in multiple states?
And it's not inexpensive.
Right. It limits us.
Yeah.
No, it's like $888. Yeah. So I would love if we could get to a point where we are like that in medicine too, where we have some type of connection between the states, because you know, you're either qualified or you're not. The states don't have different bars. There isn't a low bar for Maryland and a higher bar for Virginia. Like, it's the same, you know, you need the same qualifications to get your license in all these states. It's just a money racket, really, isn't it?
It is a money racket.
Yeah.
And if it's that much of a discrepancy, we should probably be addressing that.
Yes.
Versus not just having an interstate, like,
yes,
you know,
absolutely.
That's a completely separate issue. So,
yeah.
Amanda, do you have any favorite like mindfulness apps, you know, for patients who, you know, might want to, you know, dip their toes in the water, you know, in lead of a visit?
Yeah. So, I love that question too, because I get that a lot. And one, I would say for many people who've never meditated before, I do like using guided meditations, because what I'll say is when you're sitting there, we don't know if someone's just, if you just worry for 20 minutes, you're just strengthening your worry muscle, right? Like that's we don't actually, unless I have you hooked up to a heart mouth or something, I can't really tell exactly what's going on there. So that idea of like that guiding will help. So what's really cool with like brain imagery too. So I had mentioned John Kabat-Zinn. What was so great about his work is that a lot of people thought of meditation as very new age, right? Like, and so was this really helping? And then he started at UMass for different chronic health conditions. And we started to look at the brain and actually hook people up to electrodes as they were meditating. And what was really cool is what we noticed that the frontal lobe, that little commentary that's always going, this could be better. I want this to be different. Why, like always making a comment on who we think we are in these situations. That frontal lobe lights up a lot in people who don't meditate consistently. What's really cool is this other part, the experiential part, lights up for people who meditate consistently. So what does that mean? I could sit here and I could describe as a beautiful rendition of what it's like to eat an orange. It will never touch the experience of actually eating the orange. And you'd be amazed how many people have an orange in front of them eating and they're in the frontal lobe. I had a better orange when I was in Florida, or I had a better orange versus just experiencing it. And what's really cool is that you start to realize that somebody will say, isn't it really boring to always just focus on the breath? But if you really pay attention, each breath is slightly different. So it's really when you start to live in this experiential part of your brain, that there's a lot of benefit from that. So to your point of like using those guided meditations and making sure people know what to do when they're sitting there can be really helpful, especially if you're not going to work with somebody. But even what's cool is when you work with someone, you can tell me what your experience was during your meditation and I can walk you through it then about like, so I sometimes will record my own meditations for clients. If I'm going to use, some people will be like, your voice, you're so calming. Like, can you do a sleep meditation for me? And I'm like, sure. Whenever I would do the mindfulness groups, I always did my own recordings. So they just got very used to my voice at that point. And so different, if you like more of like an educational like course, there's things like Headspace and Calm that will literally give you like, do this week 1, do this week 2. If you're a little bit more like to explore and open-ended, I would say things like there's something called Buddhify, like Buddhify, or Insight Timer. Insight Timer is really cool because it's a lot of people just donating their time. My favorite part of that is so you're sitting there in silence all by yourself, right? For anyone who's meditated consistently, we'll tell you that we actually feel extremely much more connected to other individuals. So on Insight Timer, when you finish meditating, they show you a map of the world and everybody who is meditating at that same exact time as you. And it's just like this really cool moment of like, oh, that's awesome, right? I have no affiliation with any of these apps. And there's so many out there at this point, but there's really, my main thing to anybody is don't get caught up in researching the apps. Just do it. It would be like reading a book on a treadmill, but never getting on the treadmill. Like there's some clients who will come to me who have read triple the amount of books I have read on mindfulness. And I'll be like, have you ever done it? And they're like, no. I'm like, that's great. You have all of this academic, but you just need to do it. So I would say even before I went to that long silent retreat, I was like, I have my doctorate, right? I love to study for things. Like, how do I get prepared for this? And my mentor was like, you just go. You just go and do it, right? And then you like do it. And it's like, so if anything else, don't get wrapped up in what app specifically. Just pick one and do it. And it will take you far.
Oh, Amanda, I feel like we could talk to you all day, literally all day.
Oh, I know. It's awesome.
Will you tell our listeners where they can find you? How do they follow you online? How can they find you if they're a patient?
Yes, thank you. So if you go to my website, which is peaceofmindfulnessllc.com. So if you go there, you can just click on the contact and you can set up that free consultation call. And honestly, I'm genuinely here to help. So if someone even has one of these questions of like, you know, a book or an app, or I get all kinds of things through there, and that's fine. I love it all. I'm happy to help in any way that I can. I'm smiling a little bit because I know you lovely ladies are doing amazing on Instagram, and I support that. I laugh though because as a psychologist, we encourage people to stay off social media. I don't post very much myself on social media. I think actually, Christine, the event we did was the reason I created a business like Instagram account. So but you can go to my Instagram and it'll at least link you to my website to know how to connect with me. And I do try to post anytime I do a podcast or like a presentation in case people are interested. I actually just published my first children's book, The Worry Bug. So I posted about that on my Instagram. But the website, and then also my emails on there is usually probably the best way to get a hold of me. Not through my DMs of Instagram. I'm not on social media all that much.
Well, awesome. Thank you so much for joining us today. We really appreciate it.
It's been great.
Thank you guys, and keep doing amazing work. So my interest area, my entire career has been women's health. I love empowering women to know that it is okay to carve out this time for yourself. And if you have a hard time even doing that, maybe you really need to talk to me and I will gladly show you the ropes of why it's so important to carve out this time for yourself and to make sure you're doing what you need to do to really just invest in yourself.
100%.
Thanks, Amanda.
Thanks so much for meeting with us.
Bye.
Bye-bye.
Bye. Bye.